Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be going over the Next Generation NCLEX test plan for 2023. It actually becomes effective April 1st of 2023. I've already done the one for PN. I'm going to do the one for RN in this video. And just like PN, this is going to be a series where I plan on going over the entire booklet because I know you guys don't like to read. I'm going to go over the entire booklet in different videos, but for this particular video, I want to just go over the different types of questions so you can just get an idea of what the test writers are looking to draw from you, how you're expected to be able to think critically. But like I said, it's going to be a series where eventually, by the time I'm done with the series, I've gone over this entire booklet, but you don't have to wait on me. This is actually up on the NCSBN website, so you guys can go there, take a look yourself. You can download it and review it at your leisure. But if you're driving to the gym, you're on the subway, whatever, and you just want to listen, no problem. I do plan on covering them, but I encourage you to be an advocate for yourself. Go on the NCSBN website and take a look at the test plan yourself. All right, so I already wrote down the page numbers of where all the questions are coming from, just so we can get through this quicker. So the first set of questions on page 23. So here we are. I'm making this bigger for you so you guys can see. All right. It says the nurse has been made aware of the following client situations. The nurse should first assess the client. One, with diverticulitis, who's reporting left lower quadrant pain. B, chronic obstructive pulmonary disease, who's reporting hemoptysis. C, who had evacuation of subdural hematoma 8 hours ago and has become agitated. D, or 4, excuse me, who had a total knee replacement 8 hours ago, whose affected extremity is internally rotated. Now, this question, they're asking you who you're going to see first, which patient is the priority. That's another way of asking who is most likely to die the fastest. That is who you need to address. Now, even though all of these patients need to be addressed, who is most likely to die the quickest? Number 3. And you can see where it says key, that's what lets you know what the correct answer is. But let me explain to you why. That patient had evacuation of a subdural hematoma 8 hours ago, and now they're agitated. Let me tell you something, and I've talked about this on my video I did for test taking strategies to pass NCLEX. Whenever you're given a situation about a patient that their condition has changed for the worse, that's going to be a concern, right? On top of that, a patient that has had surgery and something has changed. Remember, when a patient has surgery, we're going to be concerned about 3 things the most. We're going to be concerned about infection. We're going to be concerned about DVT or a pulmonary embolism, and we're going to be concerned about them bleeding to death. This patient just had surgery 8 hours ago, and now they've become agitated. What is the first thing that should come to your mind to a patient that was not agitated, was not irritated before, and now they are? Or maybe they weren't lethargic before and now they are. There's a change in that cognition. We're thinking, okay, maybe that patient is not having enough oxygen to the brain, because when the patient's not having enough oxygen to the brain, we're going to see these types of characteristics. Maybe there's a bleeding that's happening in the brain. Either way, that is a patient that you need to be running to. Like I said, look at 1, diverticulitis. They're having left lower quadrant pain. That needs to be addressed. But that left lower quadrant pain, that is a clinical manifestation of the diagnosis that we know that patient has already, right? There's nothing there that tells us this patient's life is in danger or more in danger than that this patient that suddenly has become agitated. 2, the patient with COPD that's reporting hemoptysis. When that patient has COPD and it's bad, they may be spitting up blood. Do we want that to happen? Absolutely not. Do we need to check on that? Yes. But it doesn't take priority over that patient who just had surgery and now all of a sudden they've become agitated. There's nothing about that hemoptysis that's telling us that the patient's losing so much blood through the sputum that their life is in danger. Look at 4, the patient who had a total knee replacement 8 hours ago and the affected extremity is now internally rotated. Out of these choices, guys, the only one that is in immediate danger, guys, again, is number 3, that patient who had surgery 8 hours ago, and now they have agitation. Give me 1 second, guys. Okay, guys, sorry about that. Next page, 27. Okay, here's our next question. The nurse is assigning an unlicensed assistive personnel to assess the following clients to ambulate. It would be most important for the nurse to review safety precautions with the UAP prior to ambulating the 1 44-year-old with Meniere's disease, 2 59-year-old with unilateral cataract, 3 62-year-old with presbycusis, or 4 65-year-old with sinusitis. And the correct answer is that 44-year-old with Meniere's disease. Why? Think about it. What is Meniere's disease? That's a disorder of the inner ear. What is the inner ear responsible for? Balance. So this patient's going to be a safety risk. They're going to be a fall risk. The patient who has Meniere's disease, they always have a sense of like vertigo, like the room is spinning. So they're going to be at the highest risk for fall. We're going to be very concerned about making sure they have assistance ambulating. Look at the other choices. 59-year-old with unilateral cataract. It's not like they got cataract in both eyes where they have that cloudiness over both lenses. Now, even though they may be a safety risk, it's not going to be as high as the patient that has vertigo, as the patient that has problems with balance because their inner ear is affected. Remember, the inner ear is responsible for balance. So not only is the inner ear affected that's responsible for balance, they have a constant feeling of vertigo. They feel like the room is spinning, right? Look at choice 3, the client with presbycusis. So yes, let me tell you something, a matter of fact, if Meniere's disease wasn't there, then your next choice would have been presbycusis, but that's still not as high a risk of the patient with Meniere's disease by far. And then you have presbycusis, that's when the eyes are going like this, by the way. And then choice 4, you have sinusitis. The only thing that's wrong with that, okay, they're 65, they're a little bit older, and the older population, we're always going to be concerned with falls, but that still doesn't take precedence over that younger patient that's only 44, but look at the disease process, Meniere's disease. So it's important that you know the pathophysiology of different diagnoses so you can know what areas of nursing that you would have to pay special attention to, okay? Next, we're going to jump to page 31. Here we go. The nurse is teaching clients at a community health fair about risk factors for developing cancer. The nurse should recognize that at highest risk is a 30-year-old who consumes diet high in selenium and has a history of ovarian cysts. 2, 49-year-old client who drinks 2 to 3 cups of coffee daily, has a history of fibrocystic breast conditions. 3, 51-year-old who has hypertension and teaches aerobic exercise program. 4, 62-year-old client who consumes 5 to 6 alcoholic beverages daily and is an opera singer. And you guys see it's 4. So let's talk about this. Even if you didn't know offer up what the answer was, look at your choices. Number 1, we know when it comes to cancer, the older that you get, the higher your risk. This is the oldest person out of the group. That's number 1. Number 2, we know that excessive alcohol, excessive tobacco use increases your risk of cancer, 5 to 6 alcoholic beverages, and opera singers. So they're using their vocal cords a whole lot. That can cause that can put them at increased for esophageal cancer. It's not often, but it can. But even without them being an opera singer, you still had those 2 high risk factors, the age and the fact that they're drinking 5 to 6 alcoholic beverages. That's going to place them at highest risk. Look at your other choices. 1, you have a younger person, they're 30 years old, diet high in selenium, and a history of ovarian cysts, not cancer. 2, you have a 49-year-old who drinks 2 to 3 cups daily and a history of fibrocystic breast conditions, not cancer. 3, 51-year-old with hypertension and teaches aerobic exercise. Well, they have hypertension, but they're doing what? Exercising. So all of these would be minimal risk, but except for your number 4, that older patient and all that alcohol that they're drinking, okay? What page was this? This is page 31. Okay, we're going to move on to page 36. Okay, so this one is a select all that apply. You know how you treat select all that applies. You're going to treat them as true or false. The nurse is talking with a client who had a colostomy created 2 days ago. Which of the following statements by the client would indicate ineffective coping? Select all that apply. 1, I'm not touching that disgusting bag. Well, yeah, that's ineffective coping. You refuse to even touch the bag that's part of your body now that you actually are going to have to deal with. You're not coping well. You're not adjusting well. 2, I'm glad I can still go to the gym as I used to. That's good coping. You're going on with your life and you're still doing things that you enjoy. 3, I really like raw vegetables and it would be hard for me to limit them. Well, this is good coping because number one, the person is they're expressing their emotions, right? That they really like raw vegetables. But number 2, they're letting you know that they recognize as much as they like raw vegetables, those gas-forming types of foods I can't have with this colostomy. I'm going to stay away from it. So even though I like it, I know I can't have it. So that is good adjusting. 4, I understand the need for colostomy, but I'm afraid the bag will leak. That's a good adjustment. You're concerned, you're expressing your concern because you're trying to get information. That's very good. 5, I do not understand why I cannot have the nurse perform the colostomy bag changes for me. Don't you see that's almost like number 1, where you don't want to deal with it, you don't want to look at it, you don't want to touch it. You're not adjusting properly. So the correct answer choice would be 1 and 5. And you guys see why. What number was this? 36. Okay. The nurse is teaching a client who had a subtotal gastrectomy about ways to prevent dumping syndrome. Which of the following foods would be appropriate for the nurse to recommend eliminating from the client's diet? Cheese, red meats, ice cream, yellow vegetables. And the correct answer is ice cream. Why? Well, you know, one of the ways you're going to teach the patient after they've had a gastrectomy to prevent dumping syndrome is stay away from these, what are they called? These sugars. These simple sugars. Stay away from the high sugar containing like the drinks and the sodas and the ice cream, anything that's high in sugar. You're going to teach them not to eat and drink at the same time. That can also cause dumping syndrome. So just these key things regarding gastrectomy and dumping syndrome, absolutely, that you need to know. Cheese, red meat, yellow vegetables, nothing's really wrong with that. But simple sugars, stay away from, and do not eat and drink at the same time. Okay, the nurse is preparing to administer prescribed Odic drops to a 1-year-old. Which of the following actions should the nurse take? 1, gently pull the pinna upward and back straight, upward and straight back to straighten the auditory canal. 2, administer the drops immediately after removing them from the refrigerator to minimize the risk of bacterial growth. 3, direct the drops along the side of the ear canal to avoid instilling the medication directly into the eardrum. 4, massage the area immediately posterior to the ear after instilling the drops to facilitate distribution of the medication. And as you guys can see in the key, the correct answer is 3. And you want to put the drop on the side of the ear canal. You don't want it to go directly into the eardrum. And that's exactly why you do it. So this one is just knowing how to administer these drops. Now look at 1. You see 1, that's when you actually want to do a visualization into the ear, not when you're actually instilling drops. 2, administer the drops immediately after removing them from the refrigerator. Absolutely not. You want the drops to be room temperature. The drops being cold, that can cause them to have really bad ear pain, okay? And you can give them chills where you see them just going like that. And then 4, massage gently massage the area immediately posterior to the ear after instilling the drops. That's not necessary. So the correct answer is number 3. And the reason that you're doing it on the side is because you want to make sure you don't insert it directly into the eardrum. Now we're going to page 48. The nurse is caring for a client who's scheduled for a lumbar puncture. It would be most important for the nurse to assess the client for 1, bowel bladder function, 2, presence of true toe sign, 3, signs of increased intracranial pressure, or 4, circulation, movement, sensation of the legs. And the correct answer is signs of increased intracranial pressure. Let me tell you something, and you need to know this. Having increased intracranial pressure, lumbar puncture is an absolute contraindication. And here's why. If that patient has increased intracranial pressure and now you're withdrawing fluid, you can cause cerebral deviation. You can cause that brain to push back against the spinal column and cause further damage or even kill your patient. So that's a very important to know before any lumbar puncture. You better make sure that patient does not have increased intracranial pressure. And there's one more. Was that page 48? Yes. So one more, page 52. The nurse is assessing a client with viral meningitis. Which of the following findings would the nurse expect to observe? Select all that apply. How do we treat select all that apply? As true or false. Now, a couple things before we go over this, you guys can see what the answers are. Remember, when it comes to meningitis, and I've said this to you on previous videos, NCLEX is big on it. They expect you to know it. We tend to see this in older adolescents to younger adults. So around 18, 19, 20, 21, we tend to see this in places where it's highly populated, such as army barracks. You know, the kid turns 18, they go to the army and they're living in the barracks, or in prisons because it's a highly populated area, or even in the dorms, right? So we tend to see it in older adolescents, younger adults. What are those signs and symptoms? Fever, nausea, vomiting, photophobia, nuchorigidity, right? And then if a patient comes in with those signs and symptoms and you suspect meningitis, immediately the first thing you're going to do is put that patient in isolation, okay? Before anything else, because you need to protect the public from that patient. So anyway, with that being said, look at these signs and symptoms. Nausea, true. Vomiting, true. Piloerection, false. What is piloerection? You know how you get goosebumps and the hair on your arm just stands up? That's what piloerection is. That's not a clinical manifestation of meningitis. Bradycardia, false. If anything, with that patient not feeling so well, very often we'll see tachycardia. And 5, photophobia, where they can't stand light. That's true. That patient with meningitis don't want to be in a dim room because that light is agitating to them. So the correct answer is 1, 2, and 5. Guys, I'm so sorry if you feel like I was going fast in this video. I got 2 sick kids at home. I got work being done in the studio. So I'm literally in my living room trying to get this video accomplished before one of them comes in here screaming my name. So please forgive me if I went fast, but you guys can rewind and watch this as many times as you like. Please, please, please support me and support this channel by liking this video. Give it a thumbs up, please. Subscribe to my channel if you haven't done so already. And don't forget, I have audio lessons available on my website, nexusnursinginstitute.com. Thank you so much for watching, and you guys will catch me on the next video.